The 2013 World Health Organization, or WHO, guidelines recommended HIV viral load testing as the preferred method for diagnosing and confirming failure of antiretroviral therapy, or ART. In 2016, WHO recommended that viral load monitoring be carried out at 6 and 12 months after initiating ART, and every 12 months thereafter for virologically suppressed patients. Please refer to your country guidelines or policy on viral load monitoring. HIV viral load testing helps healthcare workers monitor how well a person is responding to treatment. The goal of treatment is for patients to have a viral load that is undetectable or low according to country guidelines. Having an undetectable or low viral load means that a person's treatment is working and that the infection is being controlled. For viral load testing, a result that is less than 1,000 copies per milliliter indicates adequate viral suppression, according to the 2016 WHO guidelines. A person on ART for at least 6 months with a HIV viral load result at or above 1,000 copies per milliliter should be closely evaluated by the healthcare provider to determine the possible causes. Some may include incorrect dosing of antiretroviral medications for the person's age or weight, or drug-related side effects that make it difficult to take the medications as prescribed, or missing doses for other reasons like not returning for refills in a timely way, or being on the wrong combination of medications, etc. If, after addressing adherence issues and providing support to patients to improve adherence to taking ART, a repeat VL or viral load test done at least 3 months after the first one still has a result with 1,000 or more copies per milliliter, the healthcare provider should consider switching the patient to a different ART regimen. Viral load testing, in addition to being essential for individual patient treatment monitoring, is an important way for programs to measure progress towards achieving the third UN AIDS 90-90-90 goal of ensuring that 90% of people receiving ART have a suppressed viral load as an essential component to achieve HIV epidemic control by 2020. In 2014, the global demand for HIV viral load testing was estimated to be nearly 7 million. By 2020, this number is expected to more than triple to almost 25 million in low and middle-income countries. There are several equipment platforms and reagent kits commercially available for HIV viral load testing. Some of these have been adapted for use with different specimen types. VL tests performed on plasma are the standard for measuring viral load using a laboratory technique called polymerase chain reaction, or PCR. However, advances in technology make it possible to measure HIV viral load using dried blood spots, or DBS. You may already be familiar with DBS samples, as these have been used for early infant HIV diagnosis for quite some time in many countries. This collection method can help expand access to VL testing more rapidly. This is due to several reasons. The samples are easier to collect from people of all ages, even very young children, and by providers that have minimal training. DBS collection presents less of a risk for accidental exposure to contaminated blood because there is no need to use large needles or glass tubes for collection. The sample is easier to transport because it doesn't require refrigeration and is very lightweight, making it especially adapted for collection in rural settings that are far from where processing laboratories may be located. Countries are starting to develop and implement guidelines for routine viral load monitoring of patients on ART using DBS. This video will go over the procedure to collect a DBS sample for HIV viral load testing. Knowing how to collect a DBS sample from a patient who is on ART for HIV viral load testing is the first step to evaluating how well that person is responding to treatment. Only a few drops of blood are needed. They can be obtained from a simple prick of the finger in children and adults, or heel or toe in infants. The blood spots can be easily dried, stored, and transported to the laboratory for analysis. In this short film, we will demonstrate the skills you need to collect high-quality DBS samples. Remember, a test result is only as good as the specimen collected. We will show you how to 1. Gather the supplies required for DBS collection. 2. Properly label DBS cards and maintain accurate specimen logs. 3. Collect a DBS sample. 4. Know if a DBS is of good quality. 5. Dry, package, and if necessary, store DBS samples properly until time of transport. Regardless of the age of the patient or location from which the sample will be collected, the preparation steps for collecting the sample will remain the same. We will begin our training by watching a nurse gather her supplies for a DBS collection using a finger prick. Keep in mind that the supplies used by your program may look slightly different from what is shown here. Your program may be using pre-packaged bundles with all the supplies needed for DBS collection. If your program does not use these bundles, you will have to gather the items separately. First, you will need a sterile, disposable blade-style lancet or glucolet. The blade should be 2.0 millimeters long or less and 1.5 millimeters wide or less. This puncture depth is critical for all children. A 2 millimeter lancet is the correct length to puncture safely without damaging bone. You can also use a microcapillary tube for sample collection. Most lancets come with a protective guard that must be removed before the blade can be activated. Once the guard is removed, the lancet should be used immediately. These sterile lancets or glucolets should be used one time only, then properly disposed of in a sharps container. Next, you will need skin disinfectant. The DBS collection bundle includes individually packed gauze swabs with alcohol. If you are not using a bundle, you will need gauze or cotton wool moistened with alcohol or spirits. Gloves with no powder are best because powder can interfere with PCR testing. If your gloves have powder, you must wash it off the gloves before handling the DBS card or touching the patient's finger to the DBS card. It's important to have a new, clean pair of gloves for each patient that receives a test. Finally, gather your necessary lab forms, a DBS collection card, and a pen. To take a DBS sample, it is important to use cards made of absorbent filter paper that are specifically made for blood collection. The area where the blood needs to be collected may be demarcated by a perforated or marked circle. You will need to be sure the blood drops are centered in the circle and that the circle is completely filled. Now we will see how to take blood samples for DBS collections. Watch as this nurse prepares to collect the sample. Use a pen to complete the laboratory requisition form as per instructions in the National Guidelines for HIV diagnostics. If the information is not complete and correct, the lab may reject the DBS. This is a very important step to ensure that the test will be run and the results can be returned. Make sure that your handwriting is clear and legible. The nurse prepares to take a DBS by thoroughly washing her hands before putting on new gloves. Gloves in DBS collection bundles do not have powder and can be used straight away. If your gloves have powder, wash your hands with gloves on to remove the powder. Having carefully placed a DBS card on a clean surface, the nurse confirms this is the correct patient to be tested and labels a DBS card in pen with the appropriate identifying information and the date of collection. She is also taking care not to touch the circles on the card with her fingers or anything else, as touching the circles can contaminate them and affect the test result. When taking DBS from a finger prick, position the identified puncture site above the heart. As you can see here, the nurse has selected where she will prick the patient's finger. The best finger to choose is the ring finger on the left hand. Select the outside of the fingertip. Do not prick the tip or very end of the finger where the bone is close to the skin. The thumb is not recommended because the prick will be more painful. Clean the area to be pricked and wait 30 seconds for the area to dry completely. If the area isn't completely dry, the spirit or alcohol may mix with the blood and cause the sample to be invalid. While waiting for the area to dry completely, uncover the lancet blade and dispose of the guard as soon as possible in regular or biohazard waste to prevent choking. The lancet should be used immediately after uncovering the blade. Note how the nurse is holding the hand firmly and pressing the lancet into the finger before depressing the trigger. Wipe away the first drop, which contains tissue fluids mixed with blood. Remember to properly dispose of the lancet in a sharps container and the gauze in a biohazard container. Hold the finger pointed down, allowing a large drop to collect before placing the drop on the card. The finger should not touch the card directly. If your first drop is too small, you may put additional drops until the spot is completely filled before you move on to the next spot. Do not go back and layer another drop on top of a spot which is already drying. Do not squeeze or milk the finger to get additional blood. If you squeeze the finger, tissue fluid may come out together with the blood, and this can cause the result to be inaccurate. Fill each circle by touching the drop of blood to the center of a marked circle on the card. Allow the blood to fill each circle completely. Try to fill all 5 spots, but if you can't, filling at least 3 circles is recommended. Full spots are needed for DBS testing, so a DBS card with 3 properly filled spots is better than a DBS card with 5 partly filled spots. A circle is full once the blood has just reached the marked line or perforation. We will review valid and invalid DBS cards in detail in a few minutes, but you may notice that, in this example, not all 5 spots are perfectly collected. However, at least 3 circles are properly filled, so this is a valid DBS card. Remember that filling 3 quality circles is better than 5 poor quality, half-filled circles. You can also use a microcapillary tube to collect the blood. When using a microcapillary tube, you should also try to collect 5 completely filled circles. If that is not possible, try to obtain at least 3 full circles. It is also possible to use EDTA microtubes to collect the blood instead of a microcapillary tube. When completed, elevate and use clean gauze and gentle pressure on the puncture site to stop the bleeding. Check the puncture site to make sure the bleeding has stopped before the patient leaves. Here are examples of correctly collected DBS samples with all 5 circles properly filled. Focus on preventing collection problems which can lead to unusable specimens. Here are a few common problems and reminders about how to avoid them, as errors with the sample collection will lead to laboratory rejections and delays in patient care. This sample has yellow rings around the blood. This may have been caused by contamination of the specimen by the disinfectant. To prevent it, let the alcohol dry completely before puncturing the skin. If you are using betadine, detergent, or any cleaner other than alcohol, wipe it off completely before taking the sample. Another possible cause is tissue fluids in the blood. You can avoid this by not squeezing the area around the puncture wound. Samples like this will be rejected by the laboratory. A problem can also arise from scratching the filter paper. To prevent this, allow full drops to contact the DBS card. Do not allow the finger to touch the card. Using too little blood also results in an untestable sample. If one of your drops is too small, you can put another drop directly on top of the wet drop until the spot is completely filled before moving on to the next circle. If you cannot get large enough blood spots, the puncture site may be cold. You may not be applying enough pressure, or you may need to choose another site and prick the patient again. If a new drop of blood is put on top of a dry drop, the spot will be layered and will not be testable. To avoid this, do not add a new drop to a drop that is already dry. If the blood spot is not centered in the lines or perforation, it may not be testable. If one of the drops is too far outside the lines, move on to another circle. You should have at least 3 testable spots on each DBS card. After DBS has been collected, it is important to handle them properly so they can be transported to laboratory facilities for accurate testing. After DBS collection, bring the card to the area set aside for drying. The cards should be set in drying racks horizontally so spots are not touching the drying rack or each other and are protected from sunlight, dust, and insects. Leave them at room temperature in the drying rack for a minimum of 4 hours and a maximum of overnight to dry completely. If the DBS has been made late in the afternoon, they can be left to dry overnight. When the drying process is complete, the blood spots have a uniformly dark brownish color and no red areas are visible anymore. Make sure the spots are completely dry before packaging. When drying specimens, don't expose them to heat or direct sunlight. Store them in plastic bags. Stack them against each other. Let them touch other surfaces where water or debris can contaminate or render the specimen invalid. If a card has not been dried correctly and completely, it may not be able to be tested. Also, remember to keep the lab forms with the DBS cards. If you also collect DBS samples for early infant diagnosis or EID, make sure to not dry VL samples and EID samples on the same rack. Putting both DBS types on the same rack can lead to contamination and potentially false positive results. Label each rack as VL or EID. Once the DBS are completely dry, prepare them for transport. The DBS cards need to be separated so that they do not touch each other. Each DBS card should be completely separated by glycine paper or glycine envelopes. If the DBS cards touch each other, blood may be transferred from one card to another, leading to incorrect results. After wrapping each DBS card in glycine paper or envelopes, put 5 to 10 individually wrapped DBS cards into a sealable plastic bag and add 10 desiccant packets to the bag. Place a humidity indicator in the DBS bag. The humidity indicator should be placed in the bag so that it can be read from the outside without opening the package. Press excess air out the bag and seal. If the packet is not going to the lab that day, leave it in a cool, dry place away from light until it is ready to be transported. Avoid leaving the DBS in a vehicle as sun and heat will deteriorate DBS. As you send out the specimens for analysis, it is critical to check that each sample is properly labeled and entered in the logbook. Be sure you have completed all paperwork necessary to track each DBS. Make sure that each sample has its corresponding laboratory requisition form and that all samples are entered in the summary sample list that accompanies the samples to the laboratory. This form helps the lab know how many total samples were shipped in the envelope. These procedures are important to facilitate the return of results. Place all the lab forms and the plastic bags of DBS into the shipping envelope. Be sure to label each shipping envelope with your clinic name, DBS specimens for viral load. This will help the lab know that these samples are for VL testing, the date you are sending the specimens to the lab. It is important to not place EID and VL samples together in one shipping envelope. Let's take a moment to review the information we've covered so far. We have discussed the materials necessary for collecting DBS, and we have provided instructions in handling and drying specimens and preparing them to be sent to laboratories. Hopefully, you are already feeling well equipped for your role in collecting DBS specimens for viral load monitoring. Besides collecting and handling specimens properly, you need to prevent problems to make sure each test result is as accurate as possible. Here are a few pointers. First, keep accurate records. The most common reason the lab will reject a DBS is labeling errors. The lab cannot test a specimen if there are errors in labeling. Be sure that all DBS cards are labeled correctly, that laboratory requisition forms are complete and correct, and that specimen logs are kept accurately. Make sure that your handwriting is clear and easy to read. Additionally, it is important that you handle and dry the fresh samples correctly. In this video, you've seen how to collect a quality DBS that can be used for viral load monitoring as it becomes available in your country. In summary, you've learned how to gather the materials necessary for collecting DBS, fill in the information on the DBS card, laboratory requisition form, and other logbooks completely and accurately, collect the DBS specimen. DBS collection includes the following steps. Select the safest area for puncturing the finger. Puncture the skin with a sterile lancet while wearing gloves. Wipe away the first spot which contains tissue fluids. Apply the proper pressure to promote blood drop formation. Collect at least 3 high-quality spots on DBS collection cards. Dry DBS specimens. Package DBS specimens for shipping. Monitoring viral load helps the patient and clinician understand how the patient is responding to ART. The early diagnosis of viral failure for patients has medical and psychological benefits, as a delay can lead to a greater risk of serious illness, death, and transmission of virus. After viral load results are given to the patient, clinicians can turn their focus to ensuring that the patient is on the best ART regimen to achieve and maintain viral suppression. We hope this video has been helpful and informative to you, and that you have learned how to properly collect, dry, and package DBS samples for viral load monitoring. Thank you for your part in helping men, women, and children live healthier, longer lives.